So we know that on average, lifestyle interventions bring around a 3 to 5% reduction in body weight long term. And that some people lose more, which is fantastic, some less. And for some, that 3 to 5% body weight resolves symptoms of obesity. And for others, it doesn't. There's still residual symptoms, diabetes that's still there, fatty liver, arthritis, and so forth. And that's where we can augment that concept of best weight with medical therapy that at this point, the drugs on the market bring around a 7 to 8% average further reduction in body weight. So this is getting us to that 10 to 15% weight loss. And we know that with that, more symptoms of obesity can resolve. And then for others, either based on the starting weight or response to therapies and residual or like symptoms that still exist of obesity that are leading to potential complications down the road or symptoms in the now, bariatric surgery is an option. And bariatric surgery brings around a 25% body weight loss long term. And for certain people, that's the best tool if it fits with your or their goals and preferences. Bariatric surgery is an effective treatment for the real and chronic disease of obesity. It's not a shortcut. It's not the easy way out. It's the most effective treatment for a real chronic medical condition that's seated in the deep brain beyond conscious control. And can lead to a markedly improved quality of life and often a reduction in medications. So these are kind of the tools in the toolbox to consider. And our job as clinicians is to make sure you're educated on each of these, which one seems to make most sense, which one appeals to you. So in that way, we're kind of like a tour guide, like, hey, look at all these things. Or a contractor, like, these are your tools for this or that project. What are you wanting to do, and how can we help? So keeping an open mind and a lot of trial and error. A lot of trial and error and persistence. So you all have such grit and grace and not giving up, and so much courage and all that. And that's what, as a clinician working with you, it's about that kind of persistence and trial and error, trying this and trying that. And accepting if these things aren't appealing or not appropriate or not being tolerated, that we've tried and we're continuing to try. And there's areas outside of body weight and weight regulation that we can still work on.